Good afternoon. My name is Bill Bynum, and as you can see, I'm with Hope. Hope is a 23-year-old organization that started in the Mississippi Delta. We were initially focusing on small businesses, trying to create jobs that pay good wages, offer good benefits. It didn't take long, though, to learn that the Delta needed a lot more than jobs. That's absolutely critical, but they need the same things that communities anywhere need. They need health care, they need housing, they need grocery stores, they need access to basic financial services. And so we have evolved a good bit since we started as a $1.5 million loan fund in 55 counties and parishes along the river to now we are a three-state and cover all those three states as well as the greater Memphis area, conducting a pretty broad range of banking and financial services. We're a full-service bank, but we go where traditional banks don't focus. We use every tool we can find, every alphabet soup within the federal and state government. Not a lot in the state governments in our part of the world that focus on underserved communities, but we do what we can, and we try to leverage our activities by influencing policies that affect the communities and the people where we serve. Our mission, though, has not changed since we started. It was to improve lives, build assets, and strengthen communities 23 years ago, and that is still what we focus on. Over the past several years, though, we have really been beating the drum to try to focus attention on the need for financial services in communities where the poverty level has been over 20% for 3 decades in a row, deep entrenched poverty. Our part of the world has, of the 384 counties that are classified as persistently poor by the federal government, a quarter of those are in Arkansas, Louisiana, Mississippi. If you add Alabama, we probably have close to a third collectively of those counties in the nation. But you can see those dark green counties. They go from the Tidewater area of Virginia down through the Carolinas and Georgia, Alabama, Appalachia, the border counties with the U.S. and Mexico, Native American communities in the Dakotas and the Central Valley. That is disproportionately where persistent poverty lives, and those are disproportionately communities of color. But when you add it all together, you go to rural Wisconsin, you go to Appalachia, you really start to see a picture of a really diverse nation that is very much like the United States is becoming. So poverty touches everyone, and so we've been working with folks from different backgrounds to try to elevate that story as much as we can over the past several years. And I'll talk a little bit more about that. Typically, when I talk about persistent poverty, I will show how on almost every indicator of economic and social distress, those counties that are persistent poor, the ones that are highlighted dark, have the dark green borders around them, are the persistent poor counties in our region. You overlap when you have the worst education outcomes, the worst lending practices, the worst health. You have a disproportionate number of people of color. You don't have jobs. Those overlap with where poverty is most entrenched. But for this discussion, I want to talk a little bit more and focus on health, where health is worth. In the next series of maps, the shaded counties, the ones with the borders around them, are those counties where the county health rankings are in the lowest 25% by state rankings. And interestingly, in Mississippi, every county, all but one county in Mississippi and every parish in Louisiana that is at the bottom of health outcomes is also a persistent poverty county. It's also interesting that when you frame this through an equity lens, In Mississippi, we have 39 majority black, excuse me, across the Mid-South in our territory, we have 39 majority black counties. Over half of those counties are also among the counties with the lowest health outcomes. Again, these relationships extend on just almost every socioeconomic indicator that you can think of: highest rates of unemployment, highest rates of unbanked households, highest rates, lowest levels of access to education. And again, there are deep racial disparities. In 35 of the 39 majority black counties in our region, they are also persistently poor. So in the next several slides, I'm going to try to illustrate the relationship between these low health outcomes and other indicators of distress, and talk a little bit about Hope's response as a development finance organization. Again, housing and health. High cost mortgage lending is severe in rural areas. If you look at this map, the counties in the gray, shaded in gray, are the counties that have the highest rates of high cost mortgage lending, and where it exceeds the national average. Urban areas are probably the ones in white, where you don't have as much. Little Rock, up near Memphis, DeSoto County, and on the Mississippi coast in New Orleans, Baton Rouge, and Shreveport. But what you also see is that many of the counties and parishes where we have high rates of mortgage lending are also the counties where you have the lowest health outcomes. Interesting, in Humphrey County, Mississippi, where 3 out of 4 of the residents are black, 53% of all the mortgages made to African Americans were high-cost mortgages. So you see the racial and equity overlap. Housing affects health in major ways. Housing conditions, homes that don't have safe physical standards, people who live in extreme heat or cold are at higher risk of cardiovascular disease. Neighborhood conditions and poor housing situations. You don't have access to grocery stores. You don't have access to places to exercise. The financial burden of housing, unaffordable housing, can prevent families from meeting basic needs such as nutrition and health care. We have worked very hard to try to mitigate the high-cost mortgage situation in the counties that we serve. 76% of our mortgages go to first-time home buyers. That's not a traditional bank. Our probably average mortgage is less than $100,000. Those are not, when it costs as much to make a $250,000 mortgage as it does to make a $70,000 mortgage, that's where the banks are going to focus their attention traditionally. 74% of our mortgages are to people of color, 60% to women, 43% are made in low-income census tracts. And that's an interesting number because a lot of we do a survey of our mortgage borrowers, and they report that when they become a homeowner, it allows them to move out of a low-income census tract. So people are climbing up the economic ladder. And so we're really, still, homes are the primary asset that most Americans own. It opens up opportunities to send your kids to school, to start a small business, to climb the economic ladder. So housing is really a core part of our work. Brian talked a lot about education, and certainly greater educational attainment leads to better employment opportunities, which lead to better health. Greater educational attainment, you have less unemployment, you have more income. Less unemployment means less stress. Good jobs typically have health insurance, you have paid sick leave, which all contributes to better health. Interestingly, in Mississippi, we have 30 school districts that are rated D, which is the lowest health rating. 80% of those are in persistent poverty counties, and all of those districts are majority black. And so, again, the equity issue and the health and education are closely tied together. Again, we are trying to mitigate that as best we can. We received a $8 million grant from Department of Education to finance charter school facilities. Charter school is certainly not a silver bullet. I have different, have mixed opinions on charters, but it is a tool that is out there, and if it's a tool that's going to be out there, we want to make sure that communities that need education the most have access to whatever tools exist. And so we have financed several charter schools, and we also work with the educators and administrators in those schools to help them get access to basic financial services. Disproportionately, they lack many of the tools that people need to climb the economic ladder. A lot of teachers and administrators find themselves heavily dependent on petty lenders and check cashers. And so we work closely with those residents to help them take advantage of some of the tools that we offer. Jobs and health. In Mississippi, there are only 8 counties where the unemployment rate falls below 10% for African Americans. In contrast, there are only 8 counties where the unemployment rate for white residents is above 10%. So very different employment realities across our region. In Kemper County, Mississippi, the black unemployment rate is 20%, and the white unemployment rate is 1%. Pretty significant difference in opportunities for those folks. Mississippi, all but 2 counties among those with the lowest health outcomes have unemployment rates that are more than 1.5 times the national average. So a significant, again, correlation between employment, unemployment, and health. Having a job, the benefits are obvious. It enables you to live in healthier neighborhoods. You have more money to buy healthy foods. It allows you to provide quality education to children, which reduces stress. Good jobs are also more likely to provide health insurance. Again, we don't probably intuitively connect health and jobs, but it is clear. And I think it was Robert Johnson that provided this data that laid off workers are 83% more likely to develop a stress-related condition such as a stroke, heart attack, health disease, or arthritis. So again, the parallel between jobs and health. We have been, again, I mentioned that we started as a small business loan fund. We have provided jobs in underserved communities. Disproportionately, I think 65% of our jobs at our last survey offer a good, offer health insurance to their workers, and so that's something that we focus significantly on. We import capital into these areas to try to improve access to jobs. Some of the jobs that we focus on, like our work with charter schools and education financing, focus on sectors that provide critical community infrastructure. Food access. We have a disproportionate number of food deserts across the region. This is not a rural area in New Orleans, but after Hurricane Katrina in 2004, New Orleans had the highest concentration of food deserts of any urban area in the country. We work with the city of New Orleans. They put some disaster, $7 million in disaster CDBG money on the table. We matched that with $7 million of deposits at the credit union and created a healthy food financing program. Fast forward to 2014, Tulane did a study that showed that not only had the level of food access returned to pre-Katrina levels, but importantly, food access was more equitably distributed across the city. It wasn't just in the affluent census tracts. It was equally distributed across census tracts, regardless of income, which also played out along racial lines. We worked with the Robert Johnson Foundation several years ago to create a rural health financing program, and we overlap that with some of the healthy food financing that we do, and we also are we receive resources from the Michael and Susan Dell Foundation to start to take the New Orleans experience and extend it into rural communities across our footprint. At our core, though, we're a financial institution. We're a bank. We do business lending, we do mortgage lending, but 40% of our members did not have a banking account before they joined the credit union. These are people outside the economy looking in. We believe that after a job, relationship with a financial institution may be one of the most important financial relationships that someone will have with the economy. Where you bank or does not bank affects your ability to build assets, to accumulate wealth, and determines access to and the cost of credit. You know, people who are poor pay the highest rates. And here in Alabama and Mississippi, you have some of the highest cost predatory lending in the nation. And so we have tried to mitigate that by providing access to banking services for low-income people. Since the recession, we have grown from 7 branches to 30 branches. 75% of our branches are in persistent poverty census tracts. In one 4-county cluster in the Mississippi Delta, Regions Bank actually donated several branches to us that they had acquired through mergers and acquisitions. The banks were just sitting there and not opening accounts for folks. People couldn't go in those branches and make a loan application. We took those over, and in less than 3 years, we have tripled the number of accounts that the bank that had been there for 10 plus years before had, and the number of loans that people had access to. And it's really exciting. We opened an account for a woman who on her 100th birthday opened her first banking account. You know, an African-American woman in the Mississippi Delta. And you just think what it must be like to have to live almost a century before you feel welcome enough. Someone mentioned earlier about inviting people in. She finally felt welcome enough to be able to walk in and open her first account. We also open accounts for little kids. They bring their piggy banks in and their savings, and data show that a child is 3 times more likely to go to college and 4 times more likely to graduate if they have even just a small account. So can't wait to see what these kids' future are going to be like now that they have these accounts. And many times their families, their parents who didn't have an account, feel like they need to open an account to be a better role model for their kids. So we're really excited about some of those things that we're experiencing. I mentioned earlier that we have been really beating the drum on persistent poverty, been working with groups across the country. We were able to last year pull together, a couple of years ago, pull together groups from Appalachia, from Indian country, from the colonias, and go to our policymakers. And there was $1 billion unspent in the Community Facilities Program in USDA. We couldn't by ourselves, the city of Mississippi, make the case, but collectively, we were able to go to Congress, and they pulled $500 million out and made it available to organizations like HOPE. And so we were able to get $400 million collectively and target it into community facilities for nonprofits, education facilities, nonprofit facilities, municipal facilities that often these communities don't have access to. And so collectively, we were asked to talk a little bit about some of the lessons learned. I just really feel very strongly that collective action is really critical. We are a community-owned financial institution. They hold us accountable. That 100-year-old woman is my boss. She owns the financial institution. She votes on the board. And so we listen to those folks. And I think also the closer you are to the ground, the more anchored your work will be in the needs of local residents. And so we have been working very closely, particularly since November, with local mayors who need tools, who care and work every day, go out and pick up the trash, and do what it takes to make their community successful. Well, we are essentially playing the role of their economic and community development staff, helping them to develop strategic plans and making sure, once those, talking to local residents about what their priorities are, at the end of the day, we're going to work with them to make sure that they have the tools that they need to do the things that everyone else takes for granted. So I think my time is out. Again, just, you know, New York, the Delta, Black Belt have very similar needs, but the resources that are available vary dramatically. And so it's only through pooling our efforts together that we're going to close the gap between poverty and health and education, housing, all the needs that exist in these economic distressed places. Thank you. We'll leave that up there for just a second because I have to apologize, and well, it's gone now, but I have to apologize because I'm going to have to take off at 2:30, so I won't be able to stay for the Q&A, but I really have enjoyed today's conversation. If there's any questions or any opportunities for us to work together to tackle these issues, please email me or give me a call.